Ashtavidha Pariksha. The definition of Ashtavidha Pariksha according to Ayurveda is Nadi Mutra Purish Jiva Shabda Sparsha Drishtya Kriti iti Ashtavidha Pariksha. Ashtavidha Pariksha means the eightfold examination of a patient to describe and to assess the state of health. The Ashtavid Pariksha includes Nadi Pariksha, pulse examination, Mutra Pariksha, urine examination, Malla Pariksha, stool examination, Jivha Pariksha, tongue examination, Shabda Pariksha, voice and speech examination, Sparsha Pariksha, touch examination, Drik Pariksha, eye vision examination, Akriti Pariksha, journal appearance examination. Nadi Pariksha pulse examination is examined by palpating the radial artery to determine the dominant dosha and condition of health and disease. It also indicates balance and imbalance of doshas and prognosis. Mutra Pariksha, it is examined by collecting early morning midstream urine. By observing the color, quantity, frequency, odor of the urine, we can make an analysis of infection or sugar present in urine. Mala Pariksha, stool examination. The purpose is to assess the digestion and elimination. It is also helps in diagnosing the Agni and Ama present in the body. Jivha Pariksha, observing the color, coating, fissure, movement and moisture on the tongue. The clinical importance of Jivha Pariksha is it reflects Agni, Ama and Dosha status in the body. Shabda Pariksha, voice or speech examination. It is examined by listening to the patient voice, speech and respiration. It also assesses cough, wheezing sounds and breathing sounds heard by listening to the patient. Sparsha Pariksha, touch examination. It is examined by touching patient's skin and body, observing the temperature, texture, sweating, swelling, and tenderness. The clinical significance is it is useful in fever, inflammation, and edema condition. Drik Pariksha, that is eye visual examination, observing the eye color, luster, movement, pupil, and sclera. The clinical importance of Drik Pariksha is it reflects dosha predominance, vitality, and prognosis. Akriti Pariksha, journal appearance, observing the shape, structure, gait, posture, complexion, and strength. The significance it indicates Prakriti, Bala, and Vyadhi Shamata, that is disease resistance power. Clinical importance of Ashtavidha Pariksha aids in dosha dhatu mala assessment, helps in identifying roga marga, determines disease prognosis sadhya asadhya, guides treatment planning and medicine selection, evaluates progress of disease and effectiveness of therapy. Indications of Jivha Pariksha are first, it indicates Agni status, second, it indicates the presence of armor by seeing the tongue, the coating of white thick coating, we can tell whether the arm is present or not. It also indicates doshic predominance, dhatu condition, hydration and nutrition, systemic disorders which will occur in future, and also overall health and prognosis of disease. It reflects the internal imbalance of the body which can be seen by Jivha Pariksha. Now let us see specifically the most important pariksha, Jivha Pariksha. Jivha Pariksha is the Ayurvedic method of examining the tongue to assess the state of dosha, agni, ama and dhatu in body. Methods to examine Jivha Pariksha. Ask the patient to extend tongue naturally, observe the color, coating, moisture, shape, movement, fissure if present, and taste perception. The normal tongue features are the normal tongue as shown in the above picture. It is pink or light red in color, slightly moist, coating is thin, movement is steady, and have normal taste perception. So here I have collected different photographs of different individual. So this slide shows the photos of person whose tongue is of Vataja Prakriti. The tongue of Vataja Prakriti individuals are the tongue is ruksha, dry, shita, cold, khara, rough in texture, sprushta, have cracks on their tongue, Chala, mobile, lagu, light in weight. They find it difficult to protrude the tongue. Here, the second slide shows the photographs of the Pitta Prakriti individual. The Pitta Prakriti tongue features are their tongue is reddish in color, warm to touch, oily or soft in texture. They have yellowish coating on their tongue. They are more prone to ulcers or inflammation. They have sharp taste sensation. Their tongue is moist but not excessive. So the third slide shows the photograph of the Kapha Prakriti individual. The Kapha Prakriti tongue features are their tongue is large, broad and thick. They have pale or whitish color. Their tongue is cold and heavy. They have smooth and oily surface. Thick and white coating is present on the Kapha Prakriti individual tongue. Impression or teeth marks on the sides, and they have sluggish movement. So here are various diseases which can be diagnosed by seeing the tongue. First, scarlet fever. The scarlet fever's tongue is strawberry tongue. It is bright red with prominent papillae. Initially it has white coat, but later it is very red in color. Second, liver disease. The liver disease tongue shows yellowish coating and have musty breath. Third, diabetes mellitus. The patient who has diabetes, the tongue is dry tongue with fissures on their tongue and they have high risk of candidiasis. Fourth, pitta disorders like amla pitta, pittaja jwara, pittaja varna. These all disease their tongue is red in color with yellowish coating and have burning sensation. Fifth, vata roga. The disease of vata, their tongue is dry, rough and cracked and have blackish or brownish tint on their tongue. Fifth, ajirna. The ajirna tongue is white and have thick coating. The tongue is heavy and moist. Sixth is amapresence. The amapresence tongue shows thick, sticky, foul-smelling coating which is difficult to scrape and have sluggish movement. So, the conclusion is that the tongue is the mirror of digestive system. It reflects the condition taking place inside the body. Jivha Pariksha helps in understanding the healthy state of a healthy individual and helps in diagnosis of a disease. Based on the components like Varna, Praman, Thala, Upalepa and Chalana of the tongue, different condition can be assessed. Thus, Jivha Pariksha or tongue examination must be examined very carefully, and this is an important tool for the diagnosis and prognosis of a disease. Thank you.